Professor Giacomo Pongiglione from Rome, Director of the Department of Pediatric Cardiology and Pediatric Cardiac Surgery, will now talk about the broad title Nanotechnologies in Pediatric Cardiology.
Okay. Okay, again, let me thank again the Professor Löffler, Professor Hanziker, all the organizing committee for having me here and just giving you an overview of researches I'm not directly involved, but I've done in my department. So I'm not going to tell you what nanomedicines are because I'm very sure they are know much better than me. So we can do a lot of things with nanomedicine, but certainly one thing that is absolutely clear in my mind is that with nanomedicine we have to approach things and to think in a totally different and innovative way. The application of nanotechnologies in medicine are nanomedicine, and we can envision several things we can do with that. So nanoscale structured materials, biosensors, advanced proteomics and genomics, machine systems, and diagnosis, etc., etc. There are a lot of researches going on nanomedicine, nanotechnologies, but in pediatrics in general, specifically there are certain areas that are addressed more than others. There's cardiac disease, cancer, infectious disease, sickle cell disease, and cystic fibrosis. This is because gene correction techniques is probably the best approach if you approach disease that are caused by a single gene defects, like for instance sickle cell disease or cystic fibrosis, or the treatment of HIV infections by removal the viral DNA from the body. So obviously the ultimate nanofactory is the cell, therefore it's the cell level that we have to work. One disease we approach are cardiomyopathy. In the cardiomyopathy, as you know, is the cellular machinery in the myocardium is not working. In other words, the myocardial cell is unable to generate the contractile force that is needed for proper output. And we have chosen, how do we do that? We give drugs to unload the heart, diuretics, vasodilators. When drug fails, we use mechanical support. You see on the left side is a ventricular assist device, or we remove the heart and we transplant the heart. So in other words, we don't treat cardiomyopathies. We use it as a model Duchenne muscular dystrophy because it's caused by a single gene defect, and all these children eventually will develop cardiomyopathy, and usually they die of cardiomyopathy. So the idea is to study this disease in myocytes or children before it develops. And we obtain skin biopsies by fibroblasts. We induce these cells to proliferate and become cardiomyocytes. And then we want to perform some testing, screening, transfusion of autologous cardiomyocytes when the cardiomyopathy develops. And we have seen that we have been able to induce the production of from stem cells to myocytes. And the idea is to use nanotechnologies to measure the contractile force of these new muscle cells. Another problem that we have in our work is thrombosis. And thrombosis is a very serious problem in ECMO circuits. ECMO means extracorporeal membrane oxygenator, ventricular assist devices, but always in intravascular catheters and mechanical valves. And it's apparent that coating with nanomaterials, the ECMO tubing, prevents the apposition of cells, reduces the fibrosis, and blocks the coagulation mechanism. And therefore, we have seen that coated tubes can run blood without clotting for a week without any anticoagulant or antiaggregant treatment. Then we are testing cardio nanotubes. Nanotubes could be a very good vector for transferring fragments of nucleic acid into the cell. The problem is that they are not soluble in water and they are toxic. So the idea is to develop a way of making them soluble and not toxic to transfer, DNA, of some nucleic acid fragments. So we tested multi-walled cardio nanotubes coated with polyamide polymer. We have tried polyamine PEI or polyamidoamine PAMAM coating. And we have seen that we have been able to bind nuclear DNA, but as well as RNA to the so-called carrier nanotubes. And the toxicity of the coated nanotubes is rather low. Obviously, it depends on the dose, and particularly in two lines of cells, and particularly with the PAMAM coating of the cardiac nanotubes. We have been able to demonstrate there is an effective transfer of nucleic acid within the cell, both for DNA and for RNA, and the efficiency of this transfer is rather good. Especially with with PEI is well, it was okay. With PEI was at 2 milligram per milliliter in the aqueous solution, and with PAMAM, even they say we have this 99% of transfer at half the dose. So with PAMAM is more efficient, and also the effect in upregulating or downregulating the protein is effective in this way. But we have been able also to transfer not only microRNA, but also anti-microRNA, even though less efficiently than with RNA. But again, more efficiently with PAMAM coating than with PEI coating. So in conclusion, we have prepared two different polymer-coated carrier nanotubes. The systems are able to bind small DNA and RNA molecules. Polymer carrier nanotubes are not cytotoxic, but on this point we have some reservation. We are not so sure as well, and are able to enter easily within the cell. Polymer carbon nanotubes can bind and deliver efficiently both microRNA and anti-microRNA. These novel systems are able to modulate the expression of genes up or down modulation that represent a potentially novel therapeutic tool. But in summary, so nanomedicine is a rapidly progressing field that will change our medicine practice. And there are novel diagnostic and therapeutics in all areas of medicine, including pediatric cardiology. Thank you very much.
Thank you very much for this presentation. Now, in the end, we will also have some time for discussion, hopefully. But are there already early questions or comments to this talk? If not, let us proceed to the next speaker.